Allora, la mia presentazione è qui. Okay. Hi, everybody. Here we start this for 3 days of meeting in Tarcento. And now I start my lecture. Sorry for the sounds. I turn off my phone, mobile, sorry. And let's see if we can do it. First of all, okay, there is my face. Wait a moment. No. No, niente, ho sbagliato. I made a mistake. I share with you the presentation. Si dice presentation in English? Okay. Wait a moment. Okay. We are almost done. I hope you can see my presentation. I'm not sure. Questa? Ok, volevo solo vedere. Vedi che non va avanti qua. Ah, ecco, ok. We are ready. Ok, wait a moment again. Okay, we are just little. My problem is that I don't see you. This is a problem for me. Usually, I can do it. It might be I have to set in another way the computer. No problem. Now I start with this little presentation. I hope you can enjoy it. Okay, today I would like to speak about trauma and social violence in the development of eating disorders. Definition of trauma. Trauma is a response to a deeply distressing or disturbing event that overwhelms an individual's ability to cope, leading to lasting negative effects on their mental, emotional, and sometimes physical well-being. It's not just about the event itself, but the individual's subjective experience and the lasting impact it has on their sense of safety, self, and ability to regulate emotions. Wait a moment. Okay, following Freud, a trauma is an event that is powerful enough to break through the individual's protective shield. This shield is a metaphorical barrier against excessive stimuli designed to maintain physical equilibrium. From this point of view, traumatic experiences can include sexual violence, physical assault and abuse, kidnapping and torture, war and terrorist attacks, natural disaster, the diagnosis of an incurable illness, and any event capable of endangering an individual's life. The victim of trauma may be someone who has directly experienced such situation or someone who has learned about them in various ways. So about the sexual, for example, sexual violence, wait a moment, it's important to say that this is not only when suffered directly, but also when concretely threatened. So in this case, is already a trauma. Type of trauma. There are various types of trauma, which also differ depending on the classification method used. Physical, psychological, or chemical trauma, such as from drugs or medication. For example, if we consider the type of agent causing it, so depending on the agent, varies the type of trauma. Alternatively, we can list different kinds of trauma: childhood trauma, work-related trauma, psychological abuse, stress-related, cultural, social, psychosocial, intestinal, eating-related trauma. So there are a lot of point of view where we can recognize a trauma, starting from the age of this trauma or from other sources. So the classification is quite wide. When trauma occurs, we can consider that traumatic stress can occur prenatally, perinatally, postnatally, and during adulthood. Depending on when these traumatic events take place, their effects may vary, especially in terms of magnitude and severity. For the purpose of this discussion, we are primarily interested in postnatal traumas, which earlier they occur, the greater is the damage. So before it happens, higher can be the damage. There is an important point, because there is a genetic basis that it needs a genetic basis to create an outcome. So it is not only psychological factors or social violence alone that lead to eating disorders. A neutral event, meaning one not dependent on human will, can contribute to the development of these issues. For example, a climatic event can increase the risk of an eating disorder in a child who will be born. For example, a stress experience by the pregnant woman may result in a eating disorder or in other type of psychosocial mental disorder. In 1998, for example, a severe ice storm in Quebec caused significant stress for pregnant mothers. It was observed that in that population, there was an increase in eating disorder manifestation during early adolescence among the affected individuals. This suggests that the trigger, this is an important point, the trigger must be present, something that increases the likelihood of developing this condition, as well as other disorders, particularly psychiatric ones. So the first thing is having a genetic basis. Then we need a stressor, and then a trigger, and the effect can be various, like psychiatric problems, but I am more interested in eating disorders. So there must be a genetic basis that allows it. The type of illness that can result from any kind of trauma depends on the genetic makeup each of us carries in our DNA. It's important to recall that there are epigenetic phenomena. Later, I will explain better. Here, we are focusing on eating disorders, but trauma can also lead to other kinds of issues, particularly psychiatric ones, among which eating disorders are included. Specialist literature states that eating disorders such as anorexia nervosa, bulimia nervosa, binge eating disorder, and related diagnoses like eating disorder not otherwise specified are common, complex psychiatric disorder with a significant genetic component. Aberrant genetic modifications are hypothesized to be involved in many human diseases, including complex neuropsychiatric disorders. So we arrive to epigenetics. Epigenetics is the study of all those modifications that lead to changes in gene expression without altering the DNA sequence. It is the science that investigates how the environment, lifestyle, and the external factor can modify gene expression without changing the DNA sequence. So, for example, diet, physical activity, other type of stress, and so on. So, only if the genetic makeup allows it, an eating disorder may develop, and it can take different form depending also on the type and severity of the trauma experienced. It is interesting to consider why some clinicians show a complete lack of interest in the origin of the psychiatric illness that leads to an eating disorder. In fact, if the damage has already occurred at the level of gene expression, recovery also involves the possible removal of the factors that are keeping the person ill. So we should study more what are the reasons of these problems. Going back to genetics, the scientific literature states, although psychosocial factors have been hypothesized to cause anorexia nervosa and bulimia nervosa, recent studies have shown that genetic heritability accounts for approximately 50–80% of the risk and creates neurobiological vulnerabilities. Childhood, temperament, and personality traits may create a vulnerability for the development of an anorexia nervosa, a bulimia nervosa during adolescence. Thus, the hypothesis that psychosocial factors can be an element leading to trauma suggests that psychosocial factors also play a role among the causes of the development of eating disorders. Psychosocial factors include, for example, family stress, work stress, performance stress, sport-related stress, and so on. There is, therefore, an alteration of neural circuits following interactions with the external environment. Clearly, there must already be a genetic predisposition, but one might ask, who does not have this genetic predisposition can develop an eating disorder? This is a quite interesting question. The consequence of this gene expression creates neuronal pathways that can be activated or not. Neural pathways that may respond when they shouldn't, and vice versa, resulting in disorders related to perception. The particular aspect is that this perceptual distortion, also partially defined as aberrant salience, are linked to food consumption, even though food is only a kind of medium, not the problem itself. So the subject, the individual, see the food as a medium of its problem, but is not the problem itself. Consequences. For example, cognitive disorders. The consequence of having these neural pathways that not function properly is the occurrence of perceptual distortion that manifests as cognitive disorders. There is a perceptual bias that assigns incorrect meanings to certain inputs, and there is a cognitive bias that prevents individuals from seeing possible solutions to events happening around them, resulting in harmful or unhealthy behaviors. Trauma does not only produce cognitive disorders, but also post-traumatic stress disorder, PTSD, and a whole range of comorbidities. It is not known whether it is PTSD itself that causes cognitive problems, or whether it is a parallel and additional condition. For example, preventing affected individuals from having a coherent and autonomous mental process. It should also be noted that associated with the concept of PTSD is the concept of dissociation, in which individuals tend to forget the traumatic event for a variety of reasons, extensively discussed in the specific literature. In addition, there is also psychiatric comorbidity. The issue of psychiatric comorbidity and trauma history is unavoidable for clinicians who diagnose and treat patients with eating disorder. It is very rare for patients to be just that. individuals with only an eating disorders. More commonly, there are also individuals who host other conditions or symptoms such as mood disorders, anxiety, substance use, and or personality disorders such as somatoform disorders, dissociative disorder, impulse control disorder, and disrupting behavior disorder. In fact, when it comes to eating disorder, comorbidity is truly the rule rather than the exception. So we have also comorbidity. It is important to emphasize that all these comorbid conditions have been found to be associated with histories of prior traumatic experience as well as with post-traumatic stress disorder. Victimization is another consequence. A rather significant issue for those who have experienced abuse is the risk of being abused again. That is, victimization and submissions. Those who have suffered abuse and violence, especially at young age, often develop a submissive and victimized behavioral pattern that can lead them to once again be in situations where they experience trauma and violence, cases frequently seen in individuals with eating disorders. Psychosocial and sociocultural factors. Life in society involves being exposed to a range of stimuli known as psychosocial factors. These stimuli can sometimes be very difficult to manage, especially for certain individuals. The thesis is that these psychosocial and sociocultural factors should be considered actual forms of violence. They may be modulated, disguised, or masked form of violence, but violent nonetheless. These are real form of violence. What are the psychosocial and sociocultural factors that we consider? Family, childhood trauma, sports, drugs, school and bullying, role of the media, work and career. We start with the family. The family, for obvious reasons, is the primary social and developmental environment for a child, and it is clear that its influence is immense. The family is the first educational setting, but it is also a social environment where serious problems can arise. There may be physical abuse, psychological abuse, or sexual abuse. There may be excessive demand placed on children, both in terms of academic and athletic performance, as well as behavior. Demands that may reflect cultural, religious, or ethical expectations that clash with the social context outside the family, or that simply stem from pre-existing or latent psychiatric disorder in the parent. So also the parent can have some problems, and so it is passed to the child. Again, on family, there is also the aspect of deprivation in affection, deprivation in attention, deprivation in consideration for the child, things that can cause suffering, especially in individuals who may be genetically more vulnerable in this regard. We also have families where children are used as object of display, existing only to be shown off or as extensions of the parent. An additional perspective, some parents are unable to provide their children with an adequate framework to understand the world. This is a big problem. So the teaching are wrong or not enough good, and so the child in the society can develop some problem. Childhood trauma. Identifying trauma that fall into specific categories occurring during childhood childhood is now considered a fundamental aspect of research due to the critical role they play in adult psychopathology. These traumas may include sexual abuse, physical abuse, mourning and illness, abandonment and separation, psychological abuse, including emotional abuse. Additionally, cases of victimization and bullying are also included. Sport, another psychosocial factor. Another social environment where factors for the possible development of eating disorder arise is the sport context. In many cases, sport is not seen as a moment of socialization and health, but only as performance, result, records, and money. Some young athletes undergo exhausting training to please coaches, parents, family, and friends, with the risk, among other things, of abusing doping substances and anabolic steroids. In addition to physical traumas, these young athletes risk experiencing psychosocial traumas or are encouraged to follow more or less specific diets to fit the parameters required by the sport or sports club. In every respect, the influences to which these athletes are subject should be considered forms of violence. Competition, especially when imposed, becomes a form of indirect but real violence. Numerous data indicate that athletes have more eating problems compared to non-athletes. Drugs. Drugs cause neuronal damage and an alteration in genetic expression, specifically neuronal, which means they can also trigger the onset of eating disorders through a latent activation effect. It appears that more eating disorder-related issues are stimulated also in relation to the age at which substances are used. However, it is also important to consider the possibility that underlying psychiatric condition may lead to increased consumption of substances and alcohol. School and bullying. Life in our type of society requires us to become educated and to attend educational institutions of various levels and capacities. The issue lies in the fact that within this institution, one is exposed on the one hand to a wide variety of people, and on the other hand to performance demand that can have a decisive impact on a person's future life. The demands are particularly on intellectual point of view. Again, on the same subject, in this context, there are multiple psychosocial factors: competition with peers, demands from the teaching staff, expectation of success from family, bullying. The school environment can be one of the settings where a young person may experience trauma and, based on certain genetic predisposition, develop eating disorders. The issue of bullying further clarifies how, in such environments, the condition for the development of eating disorder can easily emerge. Bullying can actually have two phases. The first is peer-to-peer bullying, which mirrors the violence present in a society, a violence that young people learn within their families and daily lives, and then replicate in the school setting, where those who are different, weaker, overweight, poorer, or even more talented become targets. The other phase of bullying is the result of the stress caused by academic competition experienced within the classroom. The specialized literature states that in adolescents, victims of bullying were at increased risk of symptoms of anorexia and bulimia nervosa, as well as associated characteristics. Bullies were at increased risk of bulimic symptoms, and victims of bullying had higher levels of anorexic symptoms. In terms of specific behaviors, bullying victims were at risk of binge eating and used vomiting as compensation behavior. Role of the media. Let us remember that media messages controlled by economic, political, religious groups, as well as by groups from the society itself, convey these media messages, convey messages that serve as a form of social control aimed at promoting the consumption of certain product, behavior in specific directions, and support for particular ideologies. Many of the messages conveyed by the media are double-bind messages, which can also have a confusing effect, leading to consequences on individual self-esteem and creating disharmony in self-perception. Regarding the field of eating disorder, the media messages of particular interest are those related to social success, physical appearance, body image, and how one should look in order to be accepted by others. Mass media and advertising produce unambiguous models, never entirely realistic. Beautiful woman with an easy life, where thin is beautiful, successful man accompanied by success and beautiful woman, where happiness is achieved through these social models that are so realistic, yet practically unattainable. These models, if not reached, lead to social comparison and feeling of frustration, shame, inadequacy, guilt, depression, lowered self-esteem, anxiety, and maladjustment, which can then lead to eating disorders. In this context, it is appropriate to mention the theme of career and success, which also affects the male gender. While women often become victims of a more evident disease, bulimia, and sometimes more severe and life-threatening disease, anorexia, men usually suffer from a related pathology that is not always so obvious and does not have short-term effect. Muscle dysmorphia, also known as bigorexia. I will say bigorexia because it's easier for me. Or bigorexia, we will speak later. In this, it is worth adding that a whole segment of the population is permeated by what could be defined as socio-economic bigorexia, where to be accepted, to avoid ridicule, and to be sure of belonging to the group, one must demonstrate success, having a nice car, a motorcycle, a beautiful wife, well-behaved children in the school, and so on. Work and career. The workplace is another social center where individuals are highly exposed to psychosocial factors. Regarding to the development of eating disorders, there is not much data related to work-related stress and trauma, mainly because most patients experience this long before the disorder manifests. So we don't have studies about this, not much studies. However, it remains a fact that over the years, the age of onset of the disease has increased, so it also occurs in adulthood, presumably also due to the stress experienced at the workplace by workers. Insight for future exploration. Studies regarding eating disorders and the traumas that cause them are continuously developing, as cases of eating disorder are steadily increasing, with possible new classification emerging. This section proposes some points to consider or that it would have been desirable to evaluate, focusing on particular emerging types of eating disorder or related topics for which there is not yet sufficient scientific data or evidence. We start with orthorexia nervosa, if anybody ever heard it. Orthorexia nervosa can be defined as an obsession with healthy food. It is an obsessive-compulsive personality disorder that arises from an increasing focus on the quality of food, unlike other types of eating disorder which focus on quantity, for example. The term orthorexis derives from Greek orthos, meaning right, correct, or proper, and orexis, meaning appetite. It is proposed, therefore, that there is a cultural type trauma where there is an altered perception of death and diseases, especially those related to diet. Individuals with this disorder very often consider food as the element that causes diseases and, at the same time, the element that cures everything, even completing replacing medicine. Hence, the concept of food as disease and food as medicine. Let's see another insight. Microbiota trauma. It is proposed, as various other authors have already done, that trauma at the intestinal microbiota level may be a trigger for the development of eating disorders. Perhaps it is more likely to be a trigger for some eating disorders than for others. An alteration of the microbiota under particular living condition and nutritional states could stimulate certain gene expression through epigenetic phenomena that alter psychic, cognitive processing, and food perception. Another type of eating disorder is the avoidant restricted food intake disorder, ARFID. This is how it is expressed. It is proposed to evaluate whether in some types of avoidant restrictive disorder there has been a food type trauma. That is, there is no social violence as a trigger for the disorder, but an incident that occurred during eating or that is associated with certain unpleasant situation experienced during the consumption of some food. It is therefore not completely excluded that social violence is involved, but when food avoidance happens due to the palatability of the product or a certain smell, perhaps there are additional elements to consider. Examples that may have caused aversion to certain food can be risk of death by choking, foodborne illness, negative events associated with food consumption. Another topic is socio-economic bigorexia. Bigorexia or bigorexia is a psychosocial disorder that arises from the distorted idea of seeing oneself as too skinny and not muscular enough, and at the same time it is characterized by an exaggerated obsession with fitness and bodybuilding. Is there in our society a sort of mental pathology where one needs to demonstrate having money, assets, power, social status in order to overcome anxiety and personal insecurity? No, this is a question. I repeat this. Is there in our society a sort of mental pathology where one needs to demonstrate having money, asset, power, social status in order to overcome anxiety and personal insecurity? Conclusions. The exact causes of eating disorders are not completely known, but it has been suggested that they relate to a genetic basis that expresses itself when stimulated by various forms of stress, trauma, and violence. These stimuli are expressed in the form of various psychosocial and socio-cultural factors. Social violence is a particular form of violence that causes trauma and must be considered for what it is, in its importance, increased magnitude in the development of eating disorders, also as a result of the evolution of our society. In other words, it is proposed that social violence is a rather characteristic stimulus for the development of eating disorders. Clearly, there must be a compatible genetic predisposition to be able to develop this illness. Moreover, precisely because social violence is constantly evolving along with society itself, this leads to an increase both in number and variety of eating disorder cases. Ultimately, individuals with eating disorder are very delicate subjects who, in a personally unstable balance, have not been sufficiently protected during their development and daily life. Clearly, all this arising from a genetic and epigenetic reasons. Consequently, due to a difficult living environment, they develop these psychiatric pathologies and the response to external event, both natural and social. Finished. Sorry for my English. You know that I'm not so good in English, but I tried to do it anyway. Okay, now I can close the YouTube direct, and so we can pass to the next presentation. Okay. Bye everybody. We see that in the next tomorrow. For who want to follow our meeting, can follow us tomorrow. Bye bye. And stream. Ecco qua.